why sleep is so fundamental because I think that as a general pediatrician, I promote sleep, haha, no pun intended, day in and day out to my patients. But it's one of those things that I think people can really overlook. They can kind of dismiss
Sure.
it as like, yeah, 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 I need sleep. But you
Yeah.
mentioned this a tiny bit. Go into how does it really, how does it affect kids developmentally when they have sleep deprivation, and how can it help
Yes.
them when they get enough sleep?
Yeah, there's a clear difference when it comes to sleep quality or quantity differences, adults versus children. In adults, we're used to
Mhm.
the typical symptoms of I'm fatigued, I'm tired, I'm sleepy, I can't stay awake during this meeting, et cetera, et cetera. For children, sleep dysfunction is usually manifested with behavioral manifestations. So it can be inattentiveness, impulsivity, a hard time with emotional regulation. So it's really behavioral manifestations. And any parent will tell you that if a child has missed their nap, they're just not more sleepy the rest of the day. They are irritable. They're cranky. They're having a really hard time with that regulation piece. And so we're really looking for the behavioral manifestations. And yes, of course, sleep dysfunction can present with fatigue and other manifestations for sure. But the primary one that we like to hone in on is the behavior stuff. And that's why if a child has, for example, symptoms that might mimic ADHD, I'm always focusing back on, is there an underlying reason why they're having this experience or they're having these symptoms? And oftentimes
Mhm.
it's due to lack of adequate sleep or something that's disrupting the quality of their sleep.
Yeah. And what are the things that you find tend to disrupt the quality of sleep or the amount of sleep most in American families? What are the things that either parents are doing, and I'm putting like quotation notes on that, or quotation quote marks on it, because I know that most parents don't like aren't actively trying to get their kids to have less sleep. But what are the things that you're noticing in terms of habits or in terms of environment that are making it so kids aren't getting the quality sleep that they need?
It differs greatly based on the age, of course, but we know that for younger children, for infants, for toddlers, oftentimes a good chunk of them, and based on large epidemiologic studies, like 30 to 50%, can have difficulty with sleep due to behavioral insomnia issues. This could be stuff known as sleep onset associations, where they get used to having caregiver involvement for getting to sleep, and with every subsequent normal awakening. It can be due to limit setting in toddlers, where they're pushing those limits, which toddlers naturally do, thereby delaying their bedtime. When you get older, then we start talking about other sleep disorders, including sleep apnea. And so children are at risk of sleep apnea, depending on the study you read, up to 4% of the population can have sleep apnea. So one out of every classroom, one child out of every classroom. You can also have restless leg, which is something that's often overlooked amongst our pediatric population. Anywhere from 1 to 6% of children can have restless leg syndrome. That can also disrupt the quality of your sleep.
For those who don't know what restless leg syndrome is, talk about that for just a second. What is that?
Absolutely, yeah. So this is usually in slightly older children. We're not going to see this in infants and toddlers, but typically at earliest around 4 or 5 years of age. There are four main clinical criteria. It's an abnormal or an uncomfortable sensation in your legs. It's present only at night, or it's worse at nighttime. It improves when they move their legs, and it gets worse if they stay still. And like all of our other medical disorders, there shouldn't be another underlying cause, like you shouldn't have neuropathy, et cetera. And it should cause some sort of daytime dysfunction. And oftentimes for children, it's actually due to iron deficiencies. Even in adults, we really have to look at iron level first, because iron serves as an important cofactor in creating dopamine for our brains. And dopamine, we know as a neurotransmitter, is important when it comes to the development of restless leg symptoms. And so oftentimes it's confused with growing pains and sometimes kind of poo-pooed. And then 10 years later, when the child is older and more expressive, they're like, no, no, in their 20s, it's not growing pains anymore. There's something else.
That phase has passed. It is still
That phase is
persisting. I still
past
have a
and it's still
problem.
there. That's right. And when you go back and you look at these patients that have restless leg as adults, a good chunk of them, their symptoms started when they were children. They just weren't able to express it or wasn't recognized until much later in life.
So we have these behavioral issues, things that are habits, maybe attachments that we make, crutches. Sometimes people call them sleep crutches that people have,
Yes.
things that people need to fall asleep. And then if they don't have them, it's more difficult to fall asleep. That idea of whatever you fall asleep with when you're falling asleep, when you wake up naturally in the middle of the night, that if it's not there, like a parent, then it's more difficult to fall back asleep because we all wake up naturally in the middle of the night as part of our sleep cycles, right?
Yes. Yes.
And then we also have environment. How important is environment, and what are the environmental factors that can help kids get the quality sleep they need?
It's a great question. It's very hard to quantify on a research basis, but we know we encapsulate all the environmental and the behavioral factors in a big term called sleep hygiene. Sleep hygiene is anything in your environment or things that you do that can hurt or help your sleep. And we know that if you take a variety of environmental factors into account, we think your sleep quality will be better. And the main ones are some of the obvious ones, which is having a comfortable, calm, quiet sleep environment we think is important. We also know that temperature of the room can be important. Everybody has slightly different preferences, but the cooler side usually helps. 68 to 72 degrees is usually the range that we give because your body temperature needs to fall a bit when you get into those deeper stages of sleep. And being able to have those cool temperatures can help with that transition to deep sleep. There are children that naturally have tendencies like needing like some sort of sensory input. So for some older children, things like weighted blankets can be helpful. In some children, white noise machines can also be helpful. But I'm a bit of a purist. I like to say that if you can avoid everything, that's ideal.